Namaste.
Hello. Namaste. Okay, welcome on the platform of Veda You Online, first time.
Thank you, ma'am.
And welcome all the attendees also for today's session. We are going to start a webinar series on mental health wellness through the lens of Ayurveda. So today we have the great Dr. Benoy N.J, sir, who is renowned Ayurvedic Psychiatrist and Physician. He graduated BMS from SJS Ayurveda College, Chennai. Dr. Benoy has received the Best Ayurvedic Doctor Award from Jayendra Saraswathi Ayurveda College. He earned MD in Ayurveda Psychiatry. So he is a specialist in mental health, especially as his post-graduation in Ayurveda Psychiatry from Kerala University of Health Sciences in Thrissur in 2014. Dr. Benoy conducted more than 3,500 lectures regarding Ayurveda and mental health in India as well as abroad. So I really warm welcome on the platform, and today we are very eager to listen your today's topic regarding depression and approach of Ayurveda. So, sir, really very welcome, and the dice is all yours. And for the listeners, there is a if you want to ask some questions or anything else, then you can post your message in chat box. At the end of a session, we will take every question of yours. So, sir, the dice is yours now.
Thank you, ma'am. We will start with a small prayer. Om Guru Brahma Guru Vishnu Guru Devo Maheshwaram Guru Sakshat Parabrahmam Tasmai Sri Gurave Namaha Namami Dhanvantari Madidevam Surasurair Vandita Padapatnam Loke Jararu Bhayamrutyunasham Dadaramisam Vividaushadhinam. Namaste, good evening to one and all. Today we will discuss in detail about depression from an Ayurvedic perspective. The Vishagam is the word for depression is given by Indian psychiatry or Indian philosophy. This section includes introduction, definition, epidemiology, etiology, type 1 classification or clinical features of depression, a mental health examination in a depressive patient, investigations should be done in a depressive patient, differential diagnosis, odds and prognosis, managements through Ayurveda, and summary and conclusion. Okay, moving on to the introduction. We all know our mood is a description of our internal emotional state. Our external and internal stimuli can trigger our moods. Sometimes we are sad, sometimes we are happy, sometimes we are very energetic, sometimes we are. So we all know that depression is a mood disorder. So when we experience an abnormal range of mood, and same time loss of control of ourselves is considered as depression. Almost 6,000 years back, Ayurveda is explained what is Vishadam, what is Unmadam. So Vishadam is a word for depression, and Kapajonmadam is the word for the depression with psychiatric features. Next, mood disorders are also known as affective disorder. So we should make clear about the affect and mood. It is very clear when the affect is sustained for a long period or a long time, it is considered as mood. So climate can be compared with mood, and weather is an affect. Next, the definition of depression. The definition of depression. Our thoughts sometimes it will be negative. Our actions will sometime be negative. And same time, what are the pleasurable things in past, but we will not able to enjoy now. Our thinking, our thoughts will always in negative. Our actions also will be in negative. Hopeless, helpless. Always we in a less energetic stage. That is, physical level is there, mental level is there, and spiritual level is there. So that is the definition of depression. This man in 1896, the Kraepelin, a famous psychiatrist, is first naming manic depressive psychosis. But from so many years back, I told you, around 6,000 years back, Ayurveda given a name Vishadam. Vishadam is a disorder. If Vishada disorder, depression with a psychotic feature, it is considered as Kapacho Unmada. Then we already discussed the definition of Ayurveda. It will be clear from the slide. It is a medical disorder. Negative affects how you feel. Our all feelings, if we are a depressive patient, will be negative. And our thinking also, our thought process and thought content also will negative. And our all actions will be negative. At the same time, loss of interest in all activities once we enjoyed. And it can lead to variety of emotional, physical problems and can decrease a person's ability to functions at work at home. Not only in home, inside our mind, in our home, in our society, everywhere, we cannot do our normal work as we done early. But the psychiatrist is giving another giving definition. That is, he is giving the symptoms in 4 way. That is motivation level, emotional level, and biological level, and cognitive level. This will be very clear from Ayurvedic perspective,
Sir, what happened?
1 minute.
You need any.
Ayurveda is defining depression. From this Sanskrit sloga, we are very, very clear. Vak kaya chitta avasadaha vishadam. Here the vak means verbally, and kaya means physically, and chitta means psychologically. So Ayurveda giving a clear definition. Verbally, physically, and psychologically, when we are in avasada state, we all are in a depressive state. Verbally, physically, and psychologically. The word vak means verbally, and kaya means physically and psychologically. It is our mental actions. Next, Ayurveda is saying that Vishadam Dukkham. If you are a depressive patient, all your thoughts will lead to sadness. All your actions will lead to sadness. Always you will be in a depressive. In your mind, you will be in a corner. In your family, you will be in a corner. And in your society, you will be in a corner. Your work, your interaction, everything will be very, very, very less. Again, maybe 30 years before, WHO given a statement that depression is the triggering factor or it can increase all diseases. Ayurveda almost 6,000 years giving a statement that Vishado Rogavardhananam. Vishado Rogavardhananam. Depression can increase all diseases. The prognosis, even management also will be a big problem. So any gastrointestinal tract disorder, any respiratory tract disorder, any neurological problem, any skeleton disorder, any joint disorders can cause by depression. So what Ayurveda is saying, mentally, physically, and spiritually, we should have it. We all know the definition of Swastha. Samadosha, Samagdishcha, Samadhatu Malakriya, Prasanna Atmendriya Mana, Swastha Vidyade. The last line is for mental health. Prasanna Atma Indriya Manam. The person who have Prasanna Atma Indriya and Mana. A very good positive state of special sense organs functions and our mind and our soul. Prasanna Atma Indriya Mana. If absence of disease is not healthy. Biologically, psychologically, and spiritually, we should happy also. So try to regulate your thoughts. Always you should positive, because manayeva manushyana karanam bandhamokshayo. Mind is the causative substance for your salvation, for your attachment, for your detachment, all your work, all your work. So keep it in mind that if you are depressive, if you are a depression patient, if you are a, if you have any psychiatric symptoms, definitely it will increase all other diseases. Suppose you have any associated disorder, maybe hypertension, maybe cardiac disorder or renal function disorder, any disorder can increase the depression. And again, Ayurveda giving a very good statement. Vishadam janayati iti vishaha. Your body fluid and your psychological activity and spiritual energy is when turned to a toxic level, toxic state. Then only you will suffer from depression. I think all of you able to follow. Your blood, liver, lymph fluid, your brain, your thoughts, your thought content, your habit, your actions, anytime mixed by any toxic substance, maybe because of emotional problems, maybe because of thought problem, maybe because of food, maybe drinks, maybe drugs. So Ayurveda giving a very good statement that when your body, mind, and soul not affected by any functional or structural toxins, you will not suffer from depression. This is a Ayurveda, the Charagacharya giving a statement that Vishadam Janayadidi Vishaha. If our body and mind is not affected by any toxins, we will not suffer from depression. This is from modern side. Bipolar, male and female are equally affected. Unipolar, females are twice more than male. Depressive episodes becomes more frequent than mania. And F32, lower in married males compared to singles. I think one advantage of marriage compared to single marriage people are got less chance to suffer with the depression. And in female, in first menses, in menarche and in menopause, so many hormonal changes are taking place. In that time, they have uh, many chances to suffer from depression. When the ladies get the first menses, hormonal changes are there. When it stop, that time also so many hormonal changes is taking place in our body that will be discussed laterally. So that will leads to depression. Bipolar is more common among the professionals, but recent studies are saying that why it is in the professional, the laymen, farmers, they are not taking treatment when they are depressed. But an educated man or a professional man always consult a psychiatrist or a psychologist very immediately when they have a depressive symptom. But unfortunately, in the village, most of the people, they are not aware about the depression. They don't know about the symptoms of depression. So they are not coming to consult a psychiatrist or psychologist. So recent study saying that it is not more common in professionals only. It is common in all type of. So we will move to the etiology. Yes, Ayurveda giving a prime importance to the genetic level. What are the diseases having our parents? Definitely we will get. And Ayurveda is Giving another statement also, even the merits or positive points of last birth. Purva karma kritam pavam vyadhirupena jayate. When the Ayurveda physicians explain very chronic skin diseases, they are saying even last birth actions, maybe karma or dharma, also will lead to disorder. And there are so many biological causes behind depression. Psychologically, when you speak, rajas and tamas, those are the main cause. Biologically, vata, pitta and kapha we will discuss. Recent studies are saying that in our body, rajas and tamas and vata and pitta and kapha are taking an important role to lead depression. But environmental problems are leading so many problems. Not only depression, mania, so many psychiatric problems. So you should be very careful where you are living. Then the types and clinical features of depression. Depression, so many famous psychiatrists classified in so many ways. Among mild, moderate, and severe depression is very famous. Mild, moderate, and severe depression is very famous. But we should know what is neurotic depression and psychotic depression. We will see one by one. So severe depression is there, moderate depression is there, mild depression is there, smiling depression is there, high function depression is there, hidden depression is there, agitated depression, neurotic depression, or dysthymia, or anxiety depression. So whenever you see a doctor prescription, maybe from a psychiatrist or a psychologist, if you noticed this number, F32.2 and 296.21, according to ICD. ICD is a textbook in psychiatry. All psychiatrists in the world, they are following the code of ICD. And DSM is only for American Psychiatric Association. So, suppose in any doctor prescription, you are saying F32.2, he is a depressive patient. And 296 and 2.21 also indicating they are depressive. So you keep it in mind, this two number. We will discuss major depressive disorder. In the next slide, symptoms of major diseases will come. So the first two symptoms should include to your patient. And it should not be due to any substance disorder, substance abuse, or any other medical condition. Even vitamin B12 deficiency can lead to depression. So it is very easy to stamp a patient is in a depressive condition. But it's very, very difficult to, he is suffering a depression with psychiatric or psychological problems. Any decreased conditions of metal, minerals can lead to depressive state. But here we are discussing only about depression out of psychological problems. And social or occupational impairment should be. The first point, there are 5 among the major depressive disorder symptom, 5 should be there. The one and 2 is mandatory. At the same time, it should not be due to substance abuse or any medical condition. And the last one, there should be a social and occupational impairment. Next, in major depressive symptoms, the first one, depressive mood. As we all know, depressive mood. Patient will always in a depressive mood. Loss of interest in pleasurable activities is known as anhedonia in psychology. Changes in appetite or body weight. Sometimes depressive patient weight will increase day by day. Sometimes it will decrease day by day. And feeling of worthiness or excessive guilt. Insomnia or hypomania. Sometimes every time, morning, evening, night, the patient will sleep. In some patient, even daytime or in night, they are not able to sleep. And the sixth one is diminished concentration. For school children and from academic area, it is very easy. They will complain, I cannot concentrate. I'm not interested to study. I cannot follow my teacher class. The seventh one is psychomotor agitation or retardation. Restless and very less energetic, loss of energy, and recurrent thoughts of death or suicide. So inside your friend circle or in your family or in your society, anyone giving 5 symptoms out of this and 1 and 2 is there, and 7 to 14 days they are in a depressive mood, they are not taking any substance, drugs, ganja or any other substance, and they don't have any physical disorders which can lead to depression. I give an example, that is vitamin B12 deficiency. Maybe you are taking some drugs, allopathic drugs, that also can lead to depression. So you should cut all the mentioned things. Then the patient, your friend or patient is suffering from giving a symptom among 9 and 5 and 7 to 14 days continuously they are having this symptom, he is in a major depressive disorder. All of you should very careful. This right is very important for a doctor, for a psychologist, for a yoga therapist, yoga teacher, even for a layman. We are discussing about the psychotic symptoms of depression. What the first one is delusion. What is delusion? Patient brain is they will say, I am controlled by some other person. He is always talking about me. He doesn't like my improvement. And second is feeling of stupor. All other reflex will be absent if you talk. But if you touch the person, the patient will give an answer. A simple touch or rub or making pain on the chest, patient will respond. Hallucination, something very, very important. Perception will be in a straight way, but the patient will say another one. For example, the depressive patient will complain that somebody is very near to me. I can talk with him or her. I am hearing the another man's sound. That is visual hallucination. But if we are near to the patient, we will not able to hear. And sometimes they will give only the answer. So they are hearing the question. They are facing the question and they are answering. First patient hallucination is there. The second person hallucination is there. Third person hallucination is also there. And sometimes the visual hallucination is also come. We cannot see, but they will say somebody is there. They are showing actions. And the last one is suicidal thoughts and behavior. Among this, delusion and hallucination is there. They are psychotic. Then let me discuss what is the importance of the psychotic symptoms. So delusion, feeling of stupor and hallucination, suicidal thoughts, behavior is there. A psychologist, a yoga therapist, even a social worker cannot manage the psychiatric patient. Clinical psychologist or normal psychologist, nobody can, because patient with the psychiatric symptoms, they need medicine for reducing the delusion and hallucination. For example, you are a yoga teacher or you are a yoga therapist. You advise some asanas or mudra or some pranayama techniques. Patient will not able to follow because they are not the boss of mind. The mind is the boss of the patient. Is it clear? You cannot advise anything. So psychiatric symptoms, the patient who have depressive symptoms with the psychiatric symptoms, they should not go to clinical psychologist, yoga therapist, or social worker. Definitely, they should go to a psychiatrist. All other mild depression, moderate depression, or severe depression, I don't mind. You can consult a famous yoga therapist or a famous clinical psychologist. But in this condition, you should be very careful. If the suicidal thoughts and behavior is high, you have to be very, very, very careful. In the end of the section, we will discuss about the suicide things and all. So, moderate depression. In moderate depression, problem with the self-esteem, reduced productivity, feeling of breathlessness, increased sensitivity, excessive worrying, problems at home, and they feel difficulty in work. They will not able to interact normally in social work. But sometimes they will be able to do all the things. So in major depression, all symptoms will be present and totally in daily regimen, in their daily activity, in their thought process, and all area they will negative. Next we'll move to the mild depression. Irritability and anger. Hopelessness. Feeling of guilty. And loss of interest and activities we enjoyed previously. Lack of motivation. If you have all the symptoms, we have mild depression. Mild depression is very common in the public. Mild depression is very common in the society. A sudden descendant of socializing, aches and pain. So you can, if you are a doctor, in your case sheet you can add an extra point. You have any personal stress or family stress or social stress or occupational stress. If it is there, no doubt you should ask what happened, why it is. I don't mind. You can sad, you can get angry, you may be sometime aggressive or sometime you may be depressive, but you should know why you are depressive, why you are aggressive. That is something very important. According to Ayurveda, any disorder can come to anybody. The only things we should aware, why it should do affecting me, what is wrong with me. The cause is from my thoughts, or is it from my food or my drinks or from my friends, whatever it may be. So we're moving to an interesting topic, smiling depression. So someone is living in the society, they are depressive patient, but outside they are happy. When they face the public, they are very, very, very happy. But a very famous psychiatrist and psychologist will able to understand, they are suffering from depression. But DSM-5 is not recognized as a disease, smiling depression. It is diagnosed as major depressive disorder with atypical features. So American Association is not ready to accept smiling depression. They are saying that it is major depressive disorder with a atypical. Next, in smiling depression, depression affects everyone. The symptoms also vary. But the all depressive feature will be there. Changes in appetite, weight loss, sleeping problems, lack of energy, feeling of hopelessness, lack of self-esteem and self-worth. But the important thing, as someone with smiling depression may experience some or all of the above, but in public the symptoms would be mostly not completely absent. From that picture itself, it is very clear. Inside they are depressive. When they come to the public, they will happy. But physical, psychological, and hormonal level and our special sense level changes will be there, no doubt. So smiling depression, sorry, 1 minute. One minute, madam, 1 minute.
You want previous slide or next slide?
Next slide.
Okay. This one?
Next one.
Next one. This
Okay.
is
High function depression is very common among the public. Actually, we already discussed one condition. The depression is very common among the professionals. Actually, high functioning depression is very common among the professionals. It is otherwise known as persistent depressive disorder. Previously, this mental disorder is known as dysthymia. Here, the person will be very active in her occupational level, in school level, and in family function. Everywhere they are inactive. We come to an Ayurvedic point. In smiling depression, Vata and Pitta will be in a normal level. But Rajas is in an increased condition and Tamo Avarana will not be there. But in high function depression, Vata, Pitta and Rajas is increased and Kapha is decreased state. So they will able to complete all their work. They are happy also. But always they will suffer depression because of their depressive stage of mind. They will be very active. They will able to participate all their works and all. But that high functioning level will leads to a mental disorder, and it will persist for a long time also. Another next slide. Yes, from first point itself, it is very clear. Depressive mood in most of the days and most of the day. And same time, minimum period of 2 years, we should suffer from below symptoms. Then only we can call as high functioning depression. The depressive mood must include it, and 2 more of them, the below symptoms is there, we can term as he is suffering from a high functioning depression. Decreased appetite or overeating. I told you, in each depressive patient, the symptoms will be different. That is why Ayurveda is giving a statement. You don't bother about the name of the disease. You concentrate on the symptoms. And what is the patient problem? What complaint is giving to you? You manage that. You don't bother about Vishadam. You don't bother about depression. You don't bother about Kabajonmadam. You don't bother about aggressive disorder or depressive disorder. What symptoms patient is giving to you? What problem patient is suffering? You concentrate and try to manage and find out what was the cause, how he came to this level. That is something very, very important. Then it is very easy to manage. Then it is very easy to manage. Next slide. Next is hidden depression. In hidden depression, people with depression may try to hide the sign from others. In all previous depression, tamas have a role, but in hidden depression, tamas have a very predominant role. psychological activity, physical activity, spiritual activity, everything will have. May not even realize that they have depression. You know the point? In hidden depression, it is very, very, very difficult to understand. But typical symptoms such as sadness or hopelessness can be easy to recognize. The other sign of hidden depression can include using alcohol, drug abuse, irritable mood, or lack of energy, or over energy, or angry or aggressive behavior. Losing interest in pleasurable activities such as sex and other hobbies. You can notice one point, that is losing interest in all pleasurable activities is very important in depression. Sometimes all previous enjoyed activities you are not able to enjoy. No doubt you are in the door of depression. And try to follow how it is going to happen, or how it is came. Is the mistake from me, inside me, because of my food or thoughts or any other changes? So hidden depression, something very important, and we will discuss some other point also here in state of hidden depression. Suppose you are in a function, suppose you are in a festival, you will state that, sir, I am suffering from arthritis, I have IVDP, I have severe migraine problem, sir, I have psoriasis, last 10 years I am suffering from diabetes, I am taking medicine from this doctor or this hospital, but you cannot accept in any function somebody is saying, sir, I am suffering from depression. Social acceptance of psychiatric problems and psychological problem is very, 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 very less. Even our all states, we have a high education level, but I'm talking about in India, we are not ready to accept like physical disorders in our life, psychological disorders. No problem, psychological problems and physical problems are same. All psychological disorders are not incurable. Only few are incurable. And all psychiatric disorders, no need to take medicine up to the death. In Ayurveda, we can manage most of the disorders. And moving to the next slide. Prenatal depression. We discussed earlier, that is in female, in menarche and in menopause state, there is a more chance of depression. So here we are discussing about prenatal depression, defined as depression in pregnancy or around in childbirth, within first year of postpartum period, significant problem in households around the world and often occurs morbidly. So here also the perinatal depression also can happen with psychotic features and without psychotic features. So with the psychotic features is very, 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 very important. You have to be very careful. Suicide, homicide, sometimes the mother is dangerous to the baby also. Sometimes they will attack parents, husband, even child. So if in a perinatal condition, if there is psychiatric symptoms, you have to be very, very careful. So we discussed almost all the conditions mentioned in depression. How can we examine a depressive patient? So it is very clear in appearance, we will able to understand. And behavior is totally different. Dull, slow speech. Affect also different. Thought content and thought process will definitely negative. Perception, sometimes normal perception will not be there. I told you the hallucination, delusions will be there. Cognitive state, if with the psychiatric symptoms, no doubt, they cannot say what is the time, what day, what is the year. And insight also, they don't agree. They are suffering from depression. So such a people, we should immediately take to a psychiatrist. We should give medicine. It is something very serious. And what happening in mental state examination in mood level? Low and sad with the feeling of hopelessness. All our mental activity will be less. Anxiety, irritability, agitation, all will be increased. Always you feel lack of energy. You are not interested to do all in your normal activity, daily regimens, daily activity, all area you will be in that. And your mood also, sometime it will change also. And coming to the next point, the thought. Pessimistic thought is an important point of to the depressive patient. Suffer from delusion and poverty of illness. Suicide and homicidal thoughts are very high in their thoughts. Among the negative thoughts, thought process and thought content is very negative. And sometimes they will plan, sometimes they will do it in action. Next one is insight. The level of awareness and understanding of his problem or disease is considered as insight. Depression with a psychotic future, the insight will be very less. In other conditions, there will be insight. So no doubt, they will come to a psychologist, they will consult a psychiatrist, or even any other management that they are ready to take. But in all other conditions, with the psychotic features, they will not ready to consult a psychologist or a psychiatrist. Again, we are moving to Ayurvedic point. In Ayurvedic point, we all know Sattva, Rajas and Tamas are the three qualities of mind. Among Rajas and Tamas are considered as dosha. So here Charagacharya is giving an explanation about Sattva. Shuddham adoshamakhyadam kalyanam Sattva. The person who with the Sattva predominant quality, they are very clean and they are very positive. They always do all the activities according to rules and regulations. They are very happy about them. Self-awareness is there. They will be able to finish all work. In thought process, in action, in habit, in behavior, they are having a very good positive personality. They're famous in society. They will get love and respect from the family. So Sattva is considered as a very good quality of mind. And next we are moving to the Rajas. So Rajas, Satoshamakhyadam Rosham Chatva. Here the word meaning Roksham means angry or aggressiveness. always they are rough and tough. In thoughts, in action, and all other conditions. Sadosham akyadam roksham shatva. So Rajas is considered as you are predominant. You think yourself. You are always positive, or you are always aggressive. And in the second line, it is very clear. Rajasam begupashitvam. They are always talkative. They will always have sexual urge desire. Always aggressive in nature. At the same time, they are competitive in nature. So the person who have a thoughts, action and behavior or habit, predominance with more talkative, more desire to sex, and always a competitive in nature, definitely they are in Rajo predominant. Rajas is more in their mind level, in action level. The next is tamas. Sadoshamakhyadam mogham shatva. You just notice the point, mogham shatva. Mogham is confusion. In all your thoughts, all in your dream, all in your aim, you will get confused. And all to your actions, either you suffer from fear or phobia. From the second line, it will be very clear. Tamasam bhayam ajnanam. They are always in fear in nature. Ajnanam. They are not ready to study. Loss of interest in learning. Always sleepy. Alasyam. They are not at all interested to anything. And Vishadida. So, not the point. According to Ayurveda, when tamas is increased with any other sharirika dosha, no doubt there is a chance of suffering from depression. The person who have always fear, confusion, always feeling sleepy, depressive mood, they have more chance to suffer from depression. So tamas is taking a very important role according to Ayurveda in Vishadam. Next we already discussed about mind, you know. So next we are discussing about body and mind. Shariram kyabi sattvam anuvidiyade sattvam cha shariram. Sorry, there are people from out of India. So next time definitely I will write the slogan in English also. And same time I put the meaning in English also. I thought only some Ayurvedic students will attend the class. I'm really sorry. Next time I will do it. Shariram khabi sattvam anuvidiyate sattvam cha shariram. There is an inseparable connection between body and mind in healthy stage and diseased stage. Body and mind have an inseparable connection. If your body is suffering from any disorder, definitely it will affect your mind. If mind is suffering from any disorder, definitely it will affect the body also. That is why we discussed in the fifth slide, Vishadho Rogavardhananam. So, Vishadam, depressive feeling, depressive state can increase all our disease. So, we will make clear how Sattva, Rajas and Tamas or Rajas and Tamas is creating a disorder. So, Sattva, this is our normal state. It is different to individual. You are a Sattva predominant person. And don't think that somebody is only with sattva and somebody is with rajas and somebody is tamas. No. Everybody have three doshas. Without triguna, according to Ayurveda, we cannot come to the earth at all. Okay. So this is the normal stage. Sattva is normal. You are positive in your thoughts, positive in your action, positive in your habit, and positive in your behavior. You will be famous with a positive personality. So how the behavior and how the personality is taking place, it is from your thoughts. Your thought within 41 days will change to a action. Around 90 days, you are continuing the same action that will lead to a habit. 2 to 3 years, you are continuously doing or following a habit that will lead to a behavior. Behavior will tend to personality. The personality will never change, but there is some contradictory. Some are saying that only body constitution, body, sharira prakriti is not, or body constitution of body is not changeable. The mind personality or psychological personality we will able to change. Maybe that is why Ayurveda also recommending psychotherapy. So from the normal state, with the help of rajas, we already discussed the rajas person always aggressive in nature. Their thought process, their action, their habit, always in aggressive in nature. Verbally, physically, and psychologically, they are very aggressive. It is very difficult to live with a rajo predominant or increased men. They will aggressive in nature. They always speak very loudly. We will come to the depression because that is our topic. Tamas is get aggravated. Vada is decreased. And kapha is also increased. We all know other than Shita property, Vada and kapha is opposite. So whenever kapha is go up, Vada will come down. So decreased stage of Vada and increased stage of kapha associated with tamas aggravation, definitely we will move to depression. That is the exact state of depression. So when you come to the Vishada level, physically, psychologically, all Vada functions will get affected. Vayu pranasapnya pradhana heduna, Vayu tantra yantra daraha. All the activities of our body and mind is controlled by Vata. What will happen? Because of decreased stage of Vata, all our activity, Chala property of Vata. That is why a beautiful sloga is there in Yoga Pratibhaga. Chale Vade Chalam Chittam Nichale Nichalam Bhave Yogi Stwana Twamapnodi Ado Vadam Nirotaye Chale Vade. You are not able to control or regulate your Vata. If your Vata is in aggravated state, increased stage, definitely that will affect our mind. You will not reach to a stage of yogi. Will be rogi or drogi. Both are bad. And coming to the pitta, physically and psychologically, very aggressive in nature. Mania, hypomania, all condition you can compare with the pitta predominant psychiatric disorder. And no doubt, kapha is also there. All the symptoms we get from kapha. So we will move to the next point. How the process is taking place. Mild increase of doshas we consider as dukkam. So what is dukkam? Anugula Vedaniyam Sukham and Pratigula Vedaniyam Dukkam. Mild increase of physical and psychological dosha, Sharirika dosha and mental dosha will lead to dukkha. Then it will lead to Vishadham without psychotic features. A depressive state without psychiatry. Then automatically it will turn to Unmadam, Kabajonmadam with psychiatric. So this is very clear. Mild increased doshas will lead to dukkam. Dukkam will turn to Vishadham. Without psychotic features, all depressive symptoms will be there. Maybe mild, maybe moderate, maybe severe. From this Vishadham, we will move to Unmada level. That is delusion, hallucination, super stage, everything will come. It is very difficult to treat also. For this condition, in mild increase of doshas, it is very easy to treat. In Vishada level, little bit. It is not, we can say it is not curable, but we have to give medicine at least 6 months. Completely we can cure also. But Unmada, we have to be very, very careful. Internal medicine, IP treatment, psychotherapy, yoga therapy, everything is must in a Unmada patient when they get inside. So we will move to a deep level in Ayurveda Psychiatry. According to Ayurveda, the depression is happening, dearrangement or vibrama of 8 states. First, we will discuss about manas. Manyade, ababudhyade, nyayade, aneni mana. Your knowledge and what you want to do, all other thing is controlled by manas. So here, mano vibrama chindyan arthan najindyade ajindyanja chindyade. What you have to think, you will not think. What you cannot, you should not think, you will think about that. That is exact stage of depression. We should not negative at all, but always we will be in negative state. I am not good. I am idiot. I am not able to do this. I don't have energy. My family members are not supporting me. I don't like to live in my country. My country is not supporting me. Like any positive thoughts will not come. All negative thoughts will come. That is Chindyan Arthan. What you should think, you will not think. But same time, you will think what you should not. And second is buddhi. Indriyam. From Indriya Arthas is manas is collecting the knowledge, and that mind is giving to buddhi or intellect. Any dearrangement or any abnormality is taking place in the buddhi. Nityam anityamidi priyam cha apriyamidi pashyati. All living things will consider as non-living things. All wholesome things will tend to unwholesome. Everything will tend to opposite. Nityam anityamidi priyanja apriyamidi. Next is sabjna jnanam, something very important, consciousness. Sabjna jnanam, the real knowledge. If you are treating a depressive patient, a real knowledge or self-awareness of you and your patient is something very important. Sabjna jnanam. Know yourself. What is your limitation? What is your merits? You think about, make a chart. Today itself. You should know your all positive side. And same time, you should know your negative side also. But verbally, physically, psychologically, you should reduce the negative, you should increase the positive. No man, no patient is perfect. You are the man. Is increasing your positive or negative thoughts, actions, habit, or sometime any vibhrama or any dearrangement in conscious level, what will happen? Agnyadi daham, the pain, even burning and touch, you will not able to understand, will not feel. So it's something very serious. We can say that conscious is get affected. It is very, very, very Vadigonmadam and Paithigonmadam and Kapatonmadam. All three unmada, even in Vishajonmada, definitely Sabnya Jnanam is get affected in very deeply. Next is Smriti. Yes. Smriti Vibhrama. Yadhartha Jnana. From our past experience and knowledge, we have a good memory. Smriti Vibhrama tu na smarati ayadava smarati. Lack of memory or sometime partial memory will be there. You cannot reproduce all the things. So when rearrangement or any abnormality is in your smriti, that also a part of depression. Next, I would like to give one knowledge. We discussed manas, buddhi, sabnya jnanam, and smriti. In psychotic condition, definitely this 4 area will be definitely affected. But in Vishadam, may not be the 4. You got my point? Dukkha stage in sadness and Vishada, depressive stage. Only in psychiatric stage, the 8 factor will get affected. Next, Bhakti is devotion. Sri Narayana Guru is giving a beautiful definition for Bhakti in Darshanamala. Atmanusandhano Bhakti Ruchyade. Any dearrangement or abnormality in your Bhakti or devotional level, what will happen? All our activities will change. Suppose yesterday you as a member of Congress, today if you are suffering from a psychotic depression, you will say, no, Congress is not good. You will say, the other party is good. Religious and in habit and all other area will get affected. We will do the opposite things. We discussed that all enjoyable things we will not enjoy doing that things, and same time we will do the opposite also. So next is Shila. We all know, we already discussed, thoughts to action, action to habit. And habit and behavior have a very important role in your life. The public and your neighbors and your family members is going to recognize you from your habit and from your behavior. Swabhava, the word of behavior in Sanskrit, Swabhava. Swabhava means our own bhava. To you and to your family, towards your society, you are giving a bhava, you are giving a behavior. Depends on that behavior only, the family people and the society is going to recognize you. So when Shila Vibhrama is happening, what will happen? The aggressive people will turn to depressive. And depressive state will turn to aggressive. That is Shila Vibramad Akrodana Krodano Bhavati Krodana will turn to the depressive Vishada state. Chesta. Chesta Vibramad Anujita Chesto Bhavati. Any Vibhrama or any abnormality in our action level is happened. Suppose you imagine that you are attending a marriage function or a festival. You will not wear the dress according to the situation. You will not follow the rules and regulations given by the situation or the society or the government. So Chesta Vibhrama also will take place. So next, Acharya. All our traditional knowledge we will lose. We will not follow our traditional festivals, family ways. Society also have some festival. All the things we will forget. We will not do. We will not attend. So Acharya Vibhrama also will take place. So next is when Vishada is affected as, or your patient is suffering from Vishada, you should be very careful about the food. Vada decreasing food and Kapha aggravated food you should not give at all. And exercise is very, very mandatory. Acharya is giving a very beautiful book. Vada Pittamayi Pam Teje. Only Vada Pitta person is Vada Pitta disorder and Vada Pitta patient only should not do exercise. All other people. Samo predominant and Kapha predominant disease should do. All drugs. Buddhim lumbayati yadravyam matagari tuchade. Vibhrama. Any substance, any drugs is giving a Vibhrama to your buddhi or any previous mentioned age state, you should know. A sleep, you should sleep in time. Please go to at least 10 p.m. and have a 8-hour sleep. It is very, very, very important. You should not control, you should not regulate your natural urges. You should follow all the regimens. And the sex is something very important. We have another topic, I think on third day or something. So I am not discussing. So speech. Psychologically and physically, you are creating problem to somebody. Compared to both, suppose we are hurting somebody with word, it is more dangerous. So don't criticize. Don't use bad word to your colleagues or to your family members or in your office. Even you are a boss. Okay. And same time, you should regulate your mental urges. Krodha and Vishadha and Dhanya, all area you should control. Next is we are moving to management. All in Unmada state, we need a IP management. All other state we can manage with internal medicines. So many kashayams are there. Kalyanam kashayam, Daktadi kashayam, even sometimes Gluchadi kashayam. All are very effective. 15 ml of the kashaya with 16 ml of water. According to the condition, you can add any other drugs also. Ashwagandharishtam, Drakshadishtam also is very effective in Vishada Roga or depression. Kushmanda Rasayanam, Ashwagandha Rasayanam are more effective. There are so many guligas. Manasamitram Vadakam, Unmada Harirasa. So many rasa preparations are available in Guliga form. And Churna, Saraswata Churnam, Manomitram Churnam, all are very effective in Urma. And Panchakarma. We all know Ayurveda is giving prime importance to the Panchakarma, cleansing therapy. Purification is a backbone of Ayurvedic treatment. So, first one is Vamana of 7 days according to the depression symptoms. Kalyana Gradam, Mahakalyana Gradam, Panchagabhya Gradam, or Mahat Panchagabhya Gradam. Anyone we will do Snekapana. Then mild Svedana therapy. Then we will move to Vamana. Second, we will do Virejana. So one is from upward direction, Urdhva Bhaga Vishuddhi, and second is Adho Bhaga Vishuddhi, the lower part. And Basti is having very important role in depression. Kashaya Basti and same time Sneka Basti and Matra Basti. Even in OP level, you can practice Matra Basti. Tikta Gridam, Mahadita Gridam, Panchagabhya Gridam or Mahat Panchagabhya Gridam, 16 ml to 100 ml you can give in OP level. No problem at all. It's very effective. And next is Nasya. Churna Nasyam is there. Thaila Nasyam is there. Kalka Nasyam is there. Depends on the condition you can do. Raktamosham I am not doing in a Manasika patient because it is very difficult. All other treatment I am doing in my hospital. And when the Shodhana therapy is done, you can move to Murdhini Thaila. Among the Murdhini Thaila, Shirodhara is very important. All the neurotransmitters secretions you will able to regulate with internal medicine. Takradhara is medicated buttermilk dhara is there, medicated decoction dhara is there, medicated milk dhara is there. Even with the grida or oil, medicated oil dhara is very famous. So depend on the condition. Brahmi Thaila, Dhanundaram Thaila, Mahanarayana Thaila, any one of the Thaila you can use for Shirodhara. Usually 45 minutes is the duration. Some people they will aggravate, the duration will increase 10 minutes. First day 40 minutes, second day 50 minutes, third day 60 minutes, and fourth day also 60 minutes, then 50, 40, 30 like that they will reduce. Next is Ayurvedic psychotherapy. Even Ayurveda doctors doesn't know. Ayurveda have a separate psychotherapy section. Ayurveda is giving, Acharya Vagbada is giving a very beautiful sloka. Tom Ashwase Sugurtumba Vakhe Dharmarthava Jagayi. Ashwasanam is now turned to counseling section. So Vagbada Acharya is saying that the person who is suffering from any psychological disorder, Tam Ashwase, you give a Ashwasana. You give a positive way, positive action to them. You are a good friend, no problem, you can. You are a psychologist, you can. You are a psychiatrist or psychologist, no problem. Because 6,000 years back, when Ayurveda is divided into 8 branches, the third branch is psychiatry. Vismaranam is one of the psychotherapy. What is Vismaranam? Forgot all negative negative thoughts and negative action, negative habit which has happened in our past. You should not remember about, but positive you can come. Positive you can take. So you should know that psychotherapy, Sattva Avadeya Chikitsa, is backbone of our Ayurveda psychiatry. Next is yoga. I told you yoga and Sattva Avadeya therapy and exercise and all is We cannot practice patient with the psychiatric symptoms, but neurotic and all other mild, moderate and depressive, agitated depression in any area. Hatha yoga, pranayama, that is Hatha yoga Pradipika is giving a beautiful sloka. Pranayamena yuktena sarvarogakshayoge. If you practice pranayama according to rules and regulation, it will eradicate all the diseases. Yoga chittavritti nirodha. Yoga is a wonderful science against the psychological disorder. So Hatha yoga, mudra, pranayama, all, even dhyana, dharana, all Ashtanga yoga is very, very, very effective in Vishadam without psychiatric features. So in your clinic, you can appoint a yoga therapist also. You ask to do mudra for 20 times or 20 minutes, Sasangasana or Surya Namaskara or Paschimottanasana for 10 minutes or 11 times like that. Yoga is very, very, very effective. I think my friend from Japan, Sudhakar Master, I don't know he is attending the class or not. He is applying Ashtanga yoga in so many diseases. He is very famous yoga master in Japan and Hong Kong. I think one of two his students are attending my class. Next, we are moving to warning signs of depression. The 9-1 are very, very important. You just read. Keep it in the mind. Elevated life stress and loss of daily structure, neglecting healthy coping skill, all 9. These are the warning sign of depression. You keep it in the mind. It is very, very, very important. Next, natural cleansing therapy. If at all you are not suffering from depression, for regulating your kapha and to regulate or control your tamoguna, you can have natural cleansing therapies. Salt water. Take a 1.5 to 2 liter of rock salt mixed warm water and induce vomiting. Sugarcane juice you drink at least 550 ml to 750 ml and induce vomiting. Drink boiled and warm milk, boiled and cold milk and induce vomiting. Lemon juice with salt and hot water, it will act as a good purgation. Triphala churnam you can take. Gastro oil with milk or hot water, it is very effective in natural cleansing. Yes. Next is how we can help the society. Maybe in your family, maybe in your friend circle. If suffering from depression, definitely you should support because they are psychologically ill. We don't know which area he is lacking, and same time he also. That is the difference between physical disorder and psychological disorder. In physical disorder, they know where I should go, who can treat me, who is the specialist. You just think about a patient suffering with the depression with psychotic features. So please help them, encourage them, support them in treatment. Yes, suicide. WHO giving a very good statement that, but very, very, very careful about in a depressive patient. Suicide is a very real danger when someone is depressed. So anyone in front of you giving any symptoms, they are saying, why I should leave? Sir, I don't have any scope. Sir, I am in dangerous situation. So definitely you should take to a psychologist or a psychiatrist or who can treat scientifically depression. You should help them. It is something very, very important. And next, home remedy. So you are a Vata predominant man, milk with turmeric every day, 60 ml of milk and 3 grams of turmeric. Haridra is very good to prevent the depression. Butter with gawa or amalagi juice also is very good. And you are dominant with pitta. Grape juice, cucumber juice, ghee with milk. Even grape juice with 5 ml of ghee and cucumber juice with 5 ml of ghee, it is very effective because ghee is the drug of choice in all pitta disorder, and virejanam is the main treatment, cleansing treatment of pitta. And next is kapha, that is ashcat juice with honey and turmeric powder with honey, ginger, pepper, and Indian gooseberry boiled in water, and you can take with honey. There are so many single drugs mentioned in Ayurveda. Very good example is convolvulus vulgaris, that is Medhya Visheshena Shankupushpi. Omega 3 and omega 6 is very much present in Shankupushpi, so it is very good mental rejuvenator. 3 to 4 grams is the dose. Don't take more. It will induce vomiting and loose motion. If you can take with the buttermilk of rice soup, it is very good. It will prevent the diarrhea. Single drugs, same like Shankupushpi. Jyodushmati is there, Ashwagandha is there, Haridra is there, Vaja is there, Reshti is there. Among Vaja, you should be very careful. Dose should not be more than 1 gram to 2 gram. That will lead to the vomiting and some side effects. So, what happening in depression according to Ayurveda? Yourself, you should love. Yourself, you should respect. When you from your heart, the affection and respect is going out. Maybe your wife, maybe about your subject, maybe towards your country, whatever it may be. When the love and affection and respect is going, it will lead to a sadness. At the same time, Atma Ninna. Atma Ninna means you don't have confidence yourself. Lack of confidence. I'm not suitable to this work. I'm not able to do this work. My family is not good. My family is not supporting. My country is not supporting. Always Ninda, always negative. That also you should know. So always you should respect and love yourself and your life partner and your social. Coming to the conclusion, depression is very, very, very elaborately described in Ayurveda. There is very good management. There are thousands of drug combinations are like Kashayam, Arishtam, Churna, Lekhya, Grida, and Panchakarma, psychotherapy, and various forms from yoga, Charakajarya is included in psychotherapy. So, no doubt, Ayurveda is very, very, very scientifically explained depression. We can manage also in any Ayurvedic psychiatric textbook or Ayurveda psychology textbook. You cannot see that the cause of depression is unknown. We cannot treat or we cannot manage Vishadam. Always there is incurable disease in Ayurveda, but definitely Ayurveda is saying that Vishadam is a treatable disorder. So these are the different references. Thank you for your patience listening, and very much thankful to Sadha and Santosh and Krishna. Krishnadas is the man behind all this class because he contacted Sadha, Doctor, and Santosh. What is the subject? Then we have to do what should be the subject and all. I am very, 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 very thankful to such an opportunity given by Dr. Sadha and Santosh. And one saying, I am thankful to one and all. Thank you. Thank you.
Yes, thank you very much, sir, for such a nice interactive session. And as time is flying because it's more than 1 hour, so if
Yes.
anyone want to ask the questions, then please message me on 8828220108. So in the next session, we will start with the questions of audience, and after that, we will take a new topic from sir. We will learn about anxiety in the next lecture. So, sir, thank you very much, and we'll meet after Diwali. So, happy
Okay.
Diwali to everyone. And for
Yes, I
now,
am
we are
waiting
closing
for
this
your
session.
valuable suggestion and
Yes, yes, yes. Everything will convey to the sir. So, thank you very much, and wish you happy Diwali also. Thank you.
Thank you, ma'am.